I'm Nick Vogelzang. I'm a medical oncologist specializing in chemotherapy, and I've been involved in treating mesothelioma patients for almost 30 years now. So the first patients I saw were twin sisters in the Minnesota area. And then when I moved to Chicago, I began to see a lot of the steel mill workers and a lot of World War II veterans who had been exposed to asbestos in the shipping or in the airline construction business. In fact, one of them had been a mechanic on a B-26 bomber, as I recall. And after a while, I had enough patients to say that I had to do some better drugs because we only had one drug called adriamycin. And so I set up a trial system through what's known as the Cancer and Leukemia Group B, a federally funded system. And we did about 10 or more clinical trials using new drugs. And one of the new drugs we used was a drug called trimethoprim. That's a long word, but it was given every 3 weeks, and it was the best drug that we had. Just as we were finishing that drug, we found that a new drug from a company called Lilly, or Eli Lilly, had also been tested in mesothelioma, and I began to hear rumors that it was effective. In 1998, I believe, I was approached by Lilly to ask whether I would look at some x-rays. And these x-rays were of men treated in Germany by my colleague, Dr. Hanauska. And he had given them Alimta and a drug called platinum. And in fact, the striking x-rays were so striking that I remember asking, are these in the right order? In other words, they were before and after x-rays, and I thought maybe they had them reversed. And in fact, they were not reversed. The tumors had shrunk considerably. The x-rays from Germany were striking. And so then Lilly asked if I would be willing to lead up a trial internationally to study their drug plus their drug Alimta plus platinum versus platinum alone, and I said yes. It was the first large-scale international trial ever conducted of mesothelioma, and until recently it was the largest. We found out in the early part of 2003, and we reported it at the large national cancer research meeting called ASCO in June of 2003. It was considered one of the top 5 abstracts of the year. It was submitted and published that same year in a journal called Journal of Clinical Oncology, and has remained a standard by which all therapies for mesothelioma are defined. That therapy is still used. There's been a number of attempts to improve upon it, but we have not yet been able to improve upon it.